Namaste, I am Dr. Krishna Paudel. I am currently working in Kanti Children's Hospital as Chief Consultant Pediatrician and Director. This is the only tertiary care hospital dedicated for children in this country. Currently, we are running 360 beds and we are planning to expand it to 500 beds. I was about 7 years old, I guess. I was suffering from fever and I was taken to a pediatrician who was very famous in my hometown, and probably that was the first time that I thought I got inspired by a doctor. Satisfaction and happiness I get from the patients, especially by the parents and the patients who come to me after follow-up. For example, they come to me with some problem and that problem gets relieved. They come to me after 1 week. That satisfaction and pleasure is unmeasurable, and it's much more than everything. So that attracts me, that's an inspiration for me to work better in my field as a doctor. With the beginning of COVID pandemic and beginning of COVID cases in Nepal, we were not much prepared for this pandemic in terms of supplies of personal protective equipments, in terms of arranging the doctors and arranging rooms for isolation as well as for the treatment of the suspected or proven cases of COVID. So we need to arrange an extra duty doctors team for suspected COVID management, as well as we need to arrange the extra places, the logistic wise extra wards for COVID. With the stressed doctors, stressed nurses and health workers and overall hospital staff, when we were not totally prepared is a new challenge, though we could deal that with the help of many stakeholders, including Government of Nepal, Ministry of Health. We got generous help from Alumni Children's Hospital in the name of So the Child May Live charity. They supported us in the procurement of PPE. Though my team, my health workers, all were in panic state, but we all now realize that it's our moral duty and professional duty during this time to support public and especially children who are our, who are our clients coming to our hospital. At the time when I was thinking of doing public health, I was looking for some good universities where I could apply and join for public health. And University of Melbourne was also on the top of the list, and thanks to the DFAT, Department of Foreign Affairs and Trade, which offers Australia Awards scholarships in Nepal, I applied University of Melbourne through that. The University of Melbourne, the multicultural environment there and the faculties are so approachable, which is totally different from the conventional Eastern system. There is a lot of gap between teachers and students, which I didn't find in University of Melbourne. They were friendly, they were very much approachable, and there was not much formality. I can call my professor by name. That's very unusual for me. And the lesson on global health, which were very relevant to us, very practical to us. The academic environment there was quite stimulating to learn further in public health. So that was that helps me in improving my leadership skill, because I was working in leadership position earlier also. After taking this course, it even brushed my leadership capacity. I was involved in Melbourne Population Health Student Association as an international student officer. So my advice to current students is to interact with a lot of faculties, lot of students, have a good network, because in public health or any other course, networking matters, friendship matters. We can learn from each other's culture, we can learn from good things from each other, because everyone has got at least one talent, and there are a lot of talents everywhere in Melbourne.